Hello there, my lovely. Make yourself nice and comfortable. Okay, so you're here for an ear cleaning today. Yeah? You've been having some problems for a little while, haven't you? Yeah, I think it's time we took a look and got them cleaned out for you. Okay, so do you have any specific pain today around the ears? Okay. All right then. Any discharge that you noticed? No, just feel really uncomfortable. Yeah. Yeah, okay. Well, you've been recommended to come to me for the cleaning, so that's what I'm going to do. Firstly, I will take a look down the ears just so I know what I'm doing, okay, what I'm working with. All right. Have you got a allergy to latex at all? No. Okay. I'll pop some gloves on. Are you feeling otherwise well? Good. Okay. Well, there are a few different ways that we can clean ears, and depending on what I see will determine which method I'll use today. Okay? None of them will be painful. Some things can feel a little bit uncomfortable if the ears are sore, but I'm very, very gentle, and you can always tell me if it's uncomfortable. Okay? Alright then. So, what I'll do first is just have a little wipe around the outer ear. Okay? Alright. So just keep nice and still for me. This will feel nice and cool and refreshing. Alright? Yes, very refreshing. Yeah. Okay. Little wipe here now. All done. Okay, so I'm going to use this otoscope here, okay, and it has a light, and I will look down your ear canal very, very gently just so I can see what I'm dealing with down there and how bad the wax impaction is, okay? Alright, I do need you to keep nice and still for this one. If anything is uncomfortable, please just pop up your hand, don't move your head suddenly, alright? Okay. Let's have a look here then. Okay. So I'll pull the ear up and back, my lovely, and I will just gently insert the otoscope here. Lovely. Okay. So there's a solid impaction there, I can see it. Just going to reposition and take another look from a slightly different angle. Okay. Your ear canals do look a little bit inflamed, but not as bad as I would have expected. Okay, I'll remove that now. okay there? You're doing really well. So just going to pull up and back and insert this now. Okay. Lots of old hard wax down here. Looking a little red also. Okay. Just withdraw that now. Okay. Alright. So I can see that you do have a lot of hard wax down each ear canal. Yeah, but don't worry, I'll be able to remove that for you. Okay. So what I do with a lot of my patients who have this problem, I use these special drops. This is the first line of attack, okay, so I can break down the wax. This softens the wax very, very quickly. Has a little bit of a fizzy, crackly sound, okay, that's normal. It's very pleasant for most people. So I'll get some of these down your ears, and then I'll see what I can do afterwards. Right, okay, I'll pop a couple in your left ear first. Okay, here's one and two. You right there? Good. You can hear that little fizzing sound. Perfect. And again on this side. Right. Make sure they're well mixed. And here's one and two. Okay. Good. Okay. Just make a note of that. Okay. So I've got a couple of methods I can use here. I can just go straight in with a tool like this and just have a little scrape around, or I can try and use an older method, which is irrigation or ear syringing. Okay, or you've had that done before, right? Okay, did you like it? Okay, we can certainly try the ear syringing first, and then I can remove anything that's left with the other tools. Yeah? Okay, right, well let's try that then. Okay, I have got a pre-filled syringe here, so I can use this in each ear. Okay, it will feel a little bit warm. It's not hot, it's not cold, but it will just go down the ear, swirl a little bit, and then it will all come out into the tray. Okay, so I've got this tray here. Yeah. Okay, so what I'm going to do is put a cover around your ears underneath so we don't get anything on your clothes. All right. Sometimes things can just splash a little bit. I'll just pop that on there, my lovely. Okay. Okay. Let's pop this one around the side. There we go. Okay. Alright, so should we start on this side first? Yeah? Okay. Right. So you just keep nice and still for me, alright? And if anything's uncomfortable, as I said before, just pop up your hand, okay? Okay. Here we go. Right then, I'm just going to get that ready. Perfect. And here we go. You're doing really well. Okay. Is that alright for you? Felt a bit strange. Yeah. It does. I'll just give them a little wipe. Okay. There we go. Okay, good. Let's take a little look at this side now. Okay then, that's in position, so you just relax and I'll start to get the water in your ear. Okay, my lovely, here we go. Well done. I think we've got most of it there by the look of it. Let's pop that there. Okay. Just going to give your ear a little wipe. There we go. You feeling okay? You're not dizzy or anything? Okay. Right. I'm going to take a little quick look with the otoscope again. Alright? Just to see what we're left with. Okay, there we go. Popping that in now. Okay. So the hard, big chunks look like they are mostly removed. just got a little bit of residual wax that I can get rid of with the other tools, but they're looking much cleaner now. Well, this one is anyway. Let's see what the other side looks like. We're doing well. Okay, so yeah, just going to pop the otoscope in one update. Alright. Okay. Yeah, same again here. Just a little bit extra to it. Okay, just withdraw that. Okay, so I'm going to use this little spoon-shaped tool just to remove the little bit extra there, and then I'm just going to use this special little brush just to remove any little loose bits. Okay, anything uncomfortable again, please just let me know by popping up your hand. Alright. Right then, so let's start over here, I think. Okay. Please let me know if anything doesn't feel good. Okay, I'll be very gentle. There we go. use that little brush again. Lovely. You're doing really, really well. Okay, you feeling comfortable? Good, good. I'm going to put some drops down your ears very shortly just to soothe them a little bit, okay? But I just want to check that your hearing's all right after I've been poking down there. We got lots and lots of wax out, all right? I don't really want to be poking around there too much because it will get a little bit sore. Okay. So could you just close your eyes for me a second and tell me which ear you feel the sound of my gloves, okay? All right, here we go. Okay, and now. Well done. And now. Okay, and now. And now. Okay, perfect. You can open your eyes now. Just going to whisper a few little words into your ear. Could you just repeat them for me, please? Okay. Chocolate, keyboard, 62, car, blanket. Very well done, and I'll do the same for your right ear. Ice cream, 22, motorbike, kettle, beach. Very well done. You just relax a second. I'll just update those notes there. Okay. Right, to find my other drops. Okay. Now, these will feel very soothing. Just going to give them a little mix and a shake, just to make them feel a little bit more comfortable after I've been working down there. Okay. Okay. So I'm going to put 3 of these down each ear. All right. Okay. Okay. Here's 1, 2, and 3. you a little massage. Okay, perfect. And I'll remove that cover. You like the massage? Good. Just helps to get the drops down. Just a little massage here. There we go. And I'll just remove that cover. Okay, my lovely. Well, if you're feeling fine, you're free to go. If you want me to check on you next week, I can, but if everything's fine, you don't have to come back. But if anything feels uncomfortable, just please give us a call, okay? Or if you feel that they're starting to block up again, yeah? You could use some olive oil drops down your ears. That really helps keep the wax compaction away. You're not going to stop producing the wax, but it helps keep it soft. Yeah, and please don't stick anything down your ears, but wax will naturally move to the outer ear, so you can remove it there. Yeah. Okay? Alright. Well, I hope you're much more comfortable now. Alright. Okay. So you take care and have a good day. Bye-bye. Oh, hello there, my lovely. Make yourself comfortable there. Could you just confirm your name for me? Okay, that's wonderful. Okay, my name's Dr. Sarah. Pleased to meet you. Okay, so what seems to be the trouble today? Okay. Right, okay, so you've got some popping sounds in your ears and some pain, okay? And your nose is feeling sore too, alright? Do you get allergies at all? Okay. Are you taking any antihistamines at the moment? Okay. I can see on the system that you've had problems with ear, nose and throat in the past. Yeah. Yeah, unfortunately some people that's how it is for them. They just tend to get lots of problems with allergies, ear problems, ear infections, sinus issues, and even, poorly throats and tonsils. So we can take a look at that for you. All right. Have you noticed any fevers at all? No. Okay. All right. Have you suffered with earwax build-up before? You have. Okay. All right then, my lovely. What I'm going to do is pop some gloves on, and I'm going to take a close look at you. All right. And if there's anything I can do to make you feel better today, I will do it. And I'll get you on some medicine, whatever medicine you need. Okay, so hopefully have you feeling much better soon. Alright? Okay. So just you relax there. Okay. Just have a little feel of your lymph nodes around your neck, my lovely. Okay. Anything feel sore, tender there? Okay. A little bit maybe around here that feels swollen, but nothing too major, nothing to worry about. It might just be that you've got some drainage and a little bit of an infection going on that you're not aware of. I will just take your temperature. Okay. Just to make sure. Alright. Just going to pop this inside your ear. Alright. Here we go, and you'll get a couple of beeps. temperature's okay. It's kind of borderline, but it's okay. So there might just be a little bit of something going on, but you're not really feeling much in the way of fever. Okay. So I'd just like you to open nice and wide for me, my lovely. Okay. I'm not going to use a tongue depressor today because it's on my notes that you don't like them. So let me just see what I can see without them. All right. Okay. If I have to use one, I will, but I'll try not to. Okay. Open nice and wide for me. All right. Okay. And can you say ah? Okay. And just relax. That's fine. Your throat does look absolutely fine. Couldn't see any spots or redness or swelling there. You've not had any problems swallowing? No. Okay. Fine. Do you get any post-nasal drip that's like mucus that runs down the back of your throat? You do, particularly at night. Okay. Yeah. All right. Okay. That's common with allergies and also with sinus issues. So, okay. Do you get this all year round to an extent? You do. Okay. But worse in the allergy months, of course, yeah. So it may be that you've got a perennial rhinitis, which just means, you have the nasal irritation and mucus, sneezing, that kind of thing all year round. But of course, we can be allergic to many things, not just pollens. It can be mould spores, weed pollen and house dust mites, all sorts of things all year round. Okay. Right. Okay. Let's just have a little look around your eyes. Have they been feeling sore? Okay. Okay, I'm just going to get one of my lights there and just have a closer look, okay. Okay, look a little bit red. Alrighty, okay. So I'm going to have a little look down your ears with my otoscope, my lovely, okay. See what's going on down there, alright. So just insert this little light into your ears. Tell me if anything hurts, keep nice and still. If you're not comfortable, just pop up your hand, alright, don't make any sudden movements, okay. I'll start with your left ear, my lovely. Here we go. So I'm just going to gently pull up and back on your ear and insert that now. Okay, here we go. Perfect. Well done. Right, so your ear canal looks a little bit irritated. There's some earwax down there which I would like to remove, but also I can see that your eardrum is slightly retracted and a little bit of fluid behind there. I can see a couple of bubbles. So this would indicate that you've got some degree of eustachian tube dysfunction, which just means that the tube isn't working properly to equalise the pressure, and the eardrum is being sucked slightly inwards. Do you have problems when you're flying, if you go in an aircraft yet? Yeah, okay. I have the same problem too, it's very uncomfortable. Alright, I'll remove that now. Alright there? Perfect. Let's have a little look on this side for you. I'm just going to pop that in now. Okay, so again, there's a little bit of earwax in here which looks quite hard, so I will remove that for you today. And this eardrum is also slightly retracted with some fluid behind, so it looks like both of your eustachian tubes have some degree of dysfunction. But there doesn't look to be too much redness, and I can't see any purulent discharge behind the eardrum, just some fluid there, which can make you feel very uncomfortable. It can cause dizziness, pressure, and clicking and popping noises, as you've described. Okay, I'll remove that now. There. Okay, so just change that. Okay, I'm going to take a look up your nose now, alright, to see if there's anything looking a bit sore up there. Alright, so I'm just going to push on the tip of your nose, alright, and insert this. Okay, it's a little bit uncomfortable, but I won't be there long. Okay, here we go then. Okay. Right, okay, yeah. Your nose is a little bit red. That does look like allergies. Okay. Let's take a look at this side now. Okay. Yeah, I can still see that redness up this side as well. Slightly deviated nasal septum, which just means that your nose bends a little bit to one side, but it's not completely blocking anything. Okay, just relax. I'm sorry that was a little bit uncomfortable there. Okay, so I'll just jot a couple of notes down. Okay, I'll have a little press around the outer ear. Alright, tell me if anything feels uncomfortable. I'll do a little bit of tugging and just some pressing around. Yeah, okay. So let's just have a little press around here. And tug on the ear there. Okay. Okay, that seems fine. Was anything painful there? No, that's perfect, okay. Just looking at this one now. Just going to tug a little bit on the ear there. Okay. Alright. So it doesn't seem to be any problems with the outer ear there. Okay. But I am going to remove that little bit of wax, and I am going to prescribe you some medications to try and make you feel a bit better. See if we can't remove that fluid, get the eustachian tubes to function a little bit better. Okay, and I'll also treat your nasal issues as well. Okay, because there is some redness up there, but your nose does look a little bit sore inside. Yeah, and we can get some bacteria up there as well, so I can treat that for you. Okay, So what I'd like to do is just pop some drops inside your ears, okay? This softens up the wax to make it more comfortable for me to remove. Okay, makes it break down into a softer texture for me, okay? They will fizz and crackle a little bit, but it won't be painful. Most people really love it. Alright? Okay, here we go. So, just have to give these a little mix up. You don't do any swimming or anything, or any diving, do you? Scuba diving? No, okay. Just got to be very careful with your ears when you've got eustachian tube problems with things like diving. And if you know what it feels like in a plane when there's a pressure change, it's really uncomfortable. As I said earlier, I do get problems with that, and I can get very dizzy as well, very off balance, a lot of pain, particularly when the plane is in descent, yeah? Okay. Alright then. So let me grab some paper there. So I'll just pop 2 drops inside each ear, okay? Okay, so here's 1. And 2. Perfect. There. You can hear it fizzing? Wonderful. Okay, here's 1. And 2. Okay, you good there? Perfect. So I'll just update those notes there. Okay, so what I'm going to do is I'm going to use this spoon-shaped tool here just to gently work the wax away, and I'll be following that up with this little brush, okay? Please keep nice and still. If anything hurts, just pop up your hand, alright? I'll be very, very gentle. It shouldn't be painful. There wasn't an awful lot down there, but I just wanted to remove it, okay, while you're here, okay? So I'll start with your left ear, alright? Okay, let's get that. Okay, so you're just going to feel me and hear me having a little scrape around, okay? Here we go. Pop up your thumb, is that okay? Yeah. That's coming away really well. Okay. I think we've got it all there. feel okay for you? Good. Right, around this side. Scrape around here. Okay, lovely. Starting now. Just going to go in with the brush, my lovely, the tickly bit. Okay. That's all done for you, and nice and cleaned out there. Okay, so what I'm going to prescribe for you is a cream for your nose. Okay, it's an antibacterial cream. You just need to pop a little bit on your little finger, okay, 4 times a day for 7 days, and just pop a little bit inside each nostril and rub around, and that's going to really calm down that soreness and that what looks like a little bit of a bacterial infection just on the inside of your nose. Okay, now once you've completed that for 7 days, I'm going to prescribe you a steroid nasal spray. That's just 1 spray up each nostril, okay, and you can do that for up to 14 days. That does not work straight away, it takes a little while to get working, but that should help clear the eustachian tubes and just help with that fluid build up, and it should stop the retraction of the eardrums there. So if you have more problems, obviously do come back. You've got some antihistamines, haven't you, at the moment? Yeah, okay, but I think we really need to treat that infection first and then get you on those steroids. Okay, if you do experience more pain or discomfort, obviously do come back and tell us, alright? But how are you feeling at the moment? Right, that's perfect. Are your ears feeling itchy or sore at the moment? No, okay. I'll just get your prescription sent over straight to the pharmacy so you can collect that on the way out. Okay, that's the cream. And that's the steroid spray. Okay, before you go, I've got one more drop I want to put down just to make sure your ears are feeling nice and cool for a while after I've been poking away down there. I know they're feeling okay, but this will make them feel really cool and refreshed, okay? Okay, just pop a couple of drops in each ear for you, just before you leave, okay? Here we go. There's one. And two. Good. Okay. And one. And two. There we go. Okay then, my lovely. So are you feeling okay? Wonderful. So if you just collect your prescription on the way out, okay. I won't need to see you again unless you are feeling no better or feeling worse. Then do pop back, okay. But say it's just a week of the cream and then up to 2 weeks of the steroid. Yeah. And you can also take your antihistamines as well. Okay. Alright, my lovely. Take care.